Polycystic ovarian syndrome. This complex hormonal disorder affects 1 in 10 women worldwide and 1 in 5 women in India. Few people are talking about it, and the disorder is widely misunderstood. But don't get your knickers in a bunch if you've never heard of it. We're here to SOS your PCOS. What's that now? In case you're confusing PCOS with PCOD, polycystic ovarian disorder, don't worry. PCOD is just the older term for what doctors now call polycystic ovarian syndrome. Women with PCOS may have menstrual irregularities or excess male hormone or androgen levels. The ovaries may also develop numerous small collections of fluid and fail to regularly release eggs. What causes it? While the exact cause of PCOS is not known, there are a few factors that could play a role. Excess androgen. If your ovaries produce abnormally high levels of the male hormone androgen, you're at great risk of developing PCOS. This could be aggravated by insulin resistance or low-grade inflammation. Genetics. Basically, if you have a close relative with a disorder, chances are you could develop it too. What happens to my body? PCOS manifests differently in different women. You may have scanty periods, excessive bleeding, or missed periods. Apart from this, women also experience acne, weight gain, facial hair growth, dark patches, hair loss, and in serious cases, the inability to conceive. If the imbalance gets worse, you could be at risk of obesity, infertility, type 2 diabetes, gestational diabetes, or even heart disease. Okay. Now pause this video and go give your friends with PCOS a jadoo ki jhappi. What happens to my mind? First, there's the stress of coping with all these things happening inside your body. Add on to it the fact that PCOS makes you vulnerable to depression, anxiety, and eating disorders. It doesn't end there. Trying to live up to society's standards for a woman while battling a disease that gives you all the symptoms that contradict those expectations, none of which is your fault, can seriously mess with your head. How do I treat it? If you've noticed any of these symptoms, it's best you go see a gynac. No, Google does not count, because every case of PCOS is unique to your body and lifestyle, like a hormonal snowflake. Overall, incorporating healthy eating and regular exercise have been shown to help, and stress-relieving activities like exercise, meditation, and yoga help combat the mental toll it takes. So ladies, if you're feeling wrecked, it's time to go get checked. PCOS may not be curable, but it can be managed. If you think you may have PCOS, go to a doctor, listen to your doctor, and do what your doctor tells you to do. The thing to remember though, if you have PCOS, is that you're not alone. There's a whole community of women out here to support you. PCOS may not be your friend, but we are. This video is Gynac approved. Tell us how you've dealt with PCOS in the comments below. Let's start a conversation. And don't forget to like, share, and subscribe to Vitamins 3.